The World Food Programme says the humanitarian crisis in Gaza has reached new and astonishing levels of desperation as starvation and malnutrition spread across the enclave. Earlier, the US president dismissed as irrelevant the French decision to recognise the state of Palestine at the UN in September. This evening, the British Prime Minister Keir Starmer said Israel's disproportionate military escalation in Gaza was indefensible, following a call between him and the leaders of France and Germany.
Catastrophic, calamitous and unconscionable. As the warnings grow louder, the images coming out of Gaza every day now show the horror going on inside. An enclave cut off from almost everything, except war.
We've seen a higher number of admitted children to treatment in May, June and now July. We reached a daily rate, average rate of 200 children daily admitted to treatment. And that's only the children that we were able to reach with testing and treatment.
4-year-old Amir is among the most vulnerable. He has cerebral palsy, as does his 6-year-old brother Yusuf. Their mother Sama talks of how she once fed them fruits, yogurt, homemade chicken soup, foods that are now a distant memory, as is life before this conflict began. With peace talks foundering, the US president blamed their failure on Hamas.
Hamas didn't really want to make a deal. I think they want to die, and it's very, very bad.
Are you done?
And it got to be to a point where you're going to have to finish the job. They really, they asked for things. Don't forget, we got a lot of hostages out. So now we're down to the final hostages, and they know what happens after you get the final hostages. And basically, because of that, they really didn't want to make a deal.
The US leader wouldn't comment on reports that Israel would allow countries to start parachuting aid into Gaza, a method of distribution that has in the past proven to be inadequate. Israel and the US united in their condemnation of the French decision to recognise a Palestinian state at the UN in September, a sharp change in policy from a member of the G7 group of nations. Though in Gaza, little changes as they bury their dead, knowing the days ahead will bring more of the same. Fiona Mitchell, RTE News.
Hospitals crumbling, lack of water and now patients who are malnourished and starving. Caring for the sick and injured of Gaza has never been so difficult. Just before coming on air, I spoke to Deirdre Noonan, an orthopaedic surgeon in Gaza. I began by asking her to describe the conditions in the hospital.
The worst conditions I've ever worked in my life, in my 10-year humanitarian career. There are days when we don't have water in the operating rooms because the infrastructure of the hospital is quite literally crumbling under this huge load of patients and previous attacks and lack of supplies coming in. Every day, it's a question of trying to balance what materials we have and what materials we can use for which patients. So we really are rationing healthcare in a way that we wish we didn't have to. Every day, the hospital is more crowded. In the hallways, there are patients on the floor on both sides. It's barely possible to get a stretcher through without running over somebody's foot who's admitted on the floor of a hospital, not even on a mat all the time, sometimes just on a blanket. So today I was rounding on people who are staying in stretchers, on exam tables, on 2 benches pushed together. It's so crowded, it's so appalling.
And we're now hearing that more and more patients are presenting who are malnourished and starving. How difficult is it to treat patients when they're in that condition?
It's sometimes impossible to treat them because for everything we do surgically, we need the body to heal itself. We don't heal the patient. We just line things up and get things reconnected so that they can heal. And so the patients are much more prone to infection, much more prone to wound healing problems, much more prone to bones that don't heal, which is something that will be seen further down the road because that's a slow process. But also we have healthcare workers that are not able to treat them ideally because the healthcare workers themselves are being forcibly starved.
And that's a new departure, isn't it? That the healthcare workers themselves don't have enough to eat.
Nobody has had enough to eat here since The effects of the siege that the Israeli government imposed in March 2nd really started to come into effect, and people's meager stores had run out. And so it's getting worse and worse. It's been a progressive thing, though. It's not something that was just a light switch on and off. I saw meat and chicken disappear from people's plates in early March when I was here. Now it's lucky if somebody gets a piece of bread or has a little bit of sugar to put in their tea.
You must be making very difficult decisions based on the people you are seeing, how ill they are, and as you say, if they're malnourished, whether or not they'll be able to heal. What's it like to have to do that?
It's absolutely agonizing because all of the healthcare professionals, whether they're Palestinian or international staff, they are being put in this position by decisions that have been made outside by the rest of the world that have been made to put us in this place. And it's yet another dehumanizing factor that is placed on this population. And they're terrible decisions. I never want to have to make a decision not to treat somebody that might be treatable just because I know I've got to save the resources to treat somebody else that has a better chance, or because I don't think that first person will heal. So I am cutting off arms and legs that I do not want to cut off, that should not have had to be amputated. But because of the level of degradation of the healthcare system after years of siege and attack, I don't have the luxury anymore of doing what we would consider medical normalcy anywhere else in the world.
It sounds like you're really working in next to impossible conditions. And I know you've lost colleagues in Gaza while you've been working there too. Why do you stay there?
The healthcare staff here, despite what they have been put through, continue to be beacons of hope and examples of what I think all of the rest of us should strive to be as healthcare professionals and as humans. And so for me, even though it is very difficult, and I think it is very damaging to all of us, but most particularly to the people that have lived this day in, day out for almost 2 years now. But I don't want to be anywhere else right now, because if I can be there beside them, if I can show a tiny bit of solidarity, and if I can do my part to try to make sure that this stops, it's worth it.
Dr. Deirdre Noonan, orthopaedic surgeon, thank you for speaking to us from Gaza this evening.
Thank you very much.
And for more on the situation in Gaza and first-hand reporting from the border, you can listen to Behind the Story podcast, which is available now on RTE Radio Player or wherever you get your podcasts.